So after Jake Tapper received a lot of backlash for condescendingly demanding that Alexandria Ocasio-Cortez describe exactly how she's going to fund all of her policies that would help the American people, well, one of his colleagues, Chris Cillizza, decided to come to his defense and be equally condescending to Alexandria Ocasio-Cortez, and he wrote a quote analysis titled "The $40 trillion Question Alexandria Ocasio-Cortez Couldn't Answer." And in this article, he argues on Sunday, CNN's Jake Tapper put a very simple question to Alexandria Ocasio-Cortez. How are you planning to pay for the many and various expensive programs and plans that you are either proposing or support? The New York soon-to-be Congresswoman didn't have any answers, like none. Ocasio-Cortez is making the case that if government took over more aspects of people's lives currently controlled by private industry, costs would go down on things like health insurance, so the $40 trillion price tag for her programs would be less. But again, this isn't an answer on where the money might come from to pay for them. Let's buy into Ocasio-Cortez's case that costs would shrink if the government, rather than the free market, ran things. Let's even say it would have the costs of the programs that she supports making into law. That's still $20 trillion, which has to come from somewhere, right? Tapper is doing an important public service here. He's highlighting the difference between campaigning and governing. The truth is that as a candidate, you can be for almost anything because you don't have any responsibility. You aren't in charge of managing the federal budget or reducing our deficit and debt obligations. Free stuff sounds great, but free stuff is almost never free. The truth that Ocasio-Cortez doesn't want to acknowledge is that the only, or at least the most likely way that she fills the gap between cost savings and the actual cost of the program she's proposing is to raise taxes. Yes, on the wealthy, but also, if we're being honest, on more than just the wealthy. Raising taxes is never popular unless it's someone else's taxes being raised. But if Ocasio-Cortez and Sanders and others believe that they deserve to lead, whether in Congress or in the White House, they need to be candid about both what they are for and how they propose paying for it. As Jake's interview made very, very clear, Ocasio-Cortez isn't there yet. So first of all, let me just ask Chris Cillizza why he hasn't written another article asking the senators who just voted to expand the military budget by $17 billion how they're going to pay for that. Where's your outrage there, Chris? Why aren't you calling them out for being irresponsible and seemingly just increasing the military in a way that's going to increase the deficit? Doesn't that concern you as well? Or is it only policies that save lives that offend you? Because for all of these CNN hosts, if you increase the budget and, increase the deficit to kill people in the Middle East and North Africa, they're okay with that. If you give tax cuts to rich people like Jake Tapper or Chris Cillizza, they're not going to press you that hard. They might throw in a question about how you're going to pay for it for a good measure, but they're never going to be as hard on those Republicans as they are on Democrats because they're fighting back against cries from Republicans who cry liberal bias. Now, first of all, he asks the question how Alexandria Ocasio-Cortez is going to pay for Medicare for all, and the whole premise of this article is that it's impossible. You can't do something like that. Even though other countries have figured it out, well, in the United States, we're unique in that it's impossible to pay for something like Medicare for all. That's the underlying implication of this article. But he contradicts himself because he quite literally comes up with a way to pay for Medicare for all. He states, she is proposing to raise taxes, yes, on the wealthy, but also, if we're being honest, on more than just the wealthy. So if you raise taxes, yes, that would pay for Medicare for all. But his response to that is, well, you don't want to do that because then you're raising taxes on average Americans, and that's wrong. You don't want to do that because they hate when people raise their taxes. But what's the rest of that argument, Chris? Why don't you fill it out? Because if you're a political analyst, if this is supposedly an analysis, that's how this is branded, then why aren't you telling your readers that on average, people who make less than $200,000 will net save money under a Medicare for all system? Because if they no longer have to pay their monthly health insurance premiums, well, even if you increase their taxes, they're still going to have more money in their pocket. Why aren't you telling them that? Because you're a hack, and you're just writing this article, this, quote, analysis, to attack Alexandria Ocasio-Cortez, and your agenda is crystal clear. You're a corporatist, and all you care about is protecting corporate interests. Because if Medicare for All actually did come to fruition, if we codify that into law, then what would happen to health insurance companies? They would no longer exist. Medicare for All existentially threatens healthcare providers. So you're doing their bidding. And as a result, you are helping to prop up a status quo that leads to death and bankruptcy. Do you feel good about yourself, Chris? Does that help you sleep at night knowing that you're okay with the system where people lower on the economic scale than you are having to choose to not go to the doctor because they can't afford it or they can't afford the copays? Does that make you feel okay? Probably he doesn't even know what's going on because he's a DC elite and doesn't really know or care about, those that are socioeconomically disadvantaged. But I want to get to some other arguments here because this is really, really disingenuous. He states here that even if we be extra kind to Ocasio-Cortez and we say that she only needs to come up with $20 trillion, we cut that estimate from Jake Tapper, the $40 trillion, in half. Well, that's got to come from somewhere, right? Yeah, obviously. You see, we're already spending a metric fuck ton of money on healthcare. We fund programs like Medicare, Medicaid, the Children's Health Insurance Program, the Affordable Care Act. But all of that money currently being spent on those programs, we reallocate that into expanding and improving Medicare, make sure everyone's covered, and that's already trillions of dollars that you take from those programs and you divert it into a Medicare for All system. But he's not telling you that, and that's something that's common sense, especially if you're a, quote, analyst. How do you not realize that, of course, if we're already spending money, we take that dollars that we're spending and spend it on Medicare for All? If that's going to be our only healthcare system, if government is the single payer, why would we have other programs like Medicaid, the Affordable Care Act? Of course, we wouldn't have those programs anymore because they would no longer be necessary. And it's a disingenuous argument. He knows about this. This is an individual who is well-versed in politics and policy, and he knows that he is making a disingenuous argument, and he's being intentionally misleading here. He's strategically leaving out that fact that's really important, that we reallocate money that we're already spending on healthcare, and we put that towards Medicare for All, and we just raise the additional revenue needed by raising taxes. A payroll tax, a financial transaction tax on Wall Street, a tax on individuals with higher incomes. That would fund Medicare for All. And even if we can't fully fund Medicare for All, then we put it on the deficit. If deficit spending is going to save lives and you're against that, then you have to admit that the deficit is more important than people's lives to you. That's what you've got to admit. So he also states here, you can be for almost anything because you don't have any responsibility as a candidate. You aren't in charge of managing the federal budget or reducing our deficit and debt obligations. Free stuff sounds great, but free stuff is almost never free. Right, but you see, we're not asking for free stuff. We're asking that the tax dollars, the money we're already spending and giving to the government, actually be used to help us for once. That's part of the social contract. We spend money, we give our tax dollars to the government, and in return, they're supposed to provide us with public goods and services. They give us roads to drive on. There's a military to protect us from external threats. They're supposed to make sure that we don't die if we get sick. They give us health care. But they're not doing that. The government isn't holding up its end of the bargain. So we're just saying the money that we're having taken out of our paychecks every single week, that should be helping us. But it's not currently. It's funding tax cuts for the rich. It's funding wars. So we're not asking for free stuff. We're already paying for it, Chris. That's the problem. We don't like how our money is being spent. So when you frame it as being free or even as an entitlement, that is corporate doublespeak, that's propaganda, and you need to know that you are misleading people. So at the end of the day, the extent to which CNN is going to discredit Medicare for All and, quite frankly, smear Ocasio-Cortez as someone who's naive and too young to know what's going on or to govern, they are doing the bidding of health insurers. They're doing the bidding of CNN's advertisers and their political hacks. And your concern trolling here is only delaying a policy that would save lives and stop medical bankruptcies. But these are rich individuals who are oligarchs and elites, and they really don't care what average Americans are dealing with. But you can try to fearmonger about taxes going up, But Americans are beginning to wake up to the fact that Medicare for all is the common sense way to go when it comes to healthcare. Because yes, our taxes are going to go up, but we're still going to have more money if we no longer have to pay our monthly health insurance premiums. And guess what? Everyone's covered. Nobody's left out. So the propaganda is going to continue. We're being bombarded with it because corporate oligarchs are seeing that the tide is turning. A majority of Americans, now 70%, support Medicare for all. A majority of Republicans, 51%, support Medicare for all. So the tide is turning. So they are scrambling to get us to be against a policy that would benefit us. They're scrambling to get us to be against our own best interests. But the American people are waking up, and these people are quickly discrediting themselves, and CNN is proving to be the corporate news network in America.
Support this podcast by becoming a patron at patreon.com/Humanist Report.